families and getting pregnant, being vulnerable, setting yourself up. Some of you know that in my world, I was unable to get pregnant. My ex and I, we were unable to get pregnant. And when I was an intern, so this was 38 years ago, and I called the 7 most famous doctors I'd ever heard of, and I said, what do you do for infertility? They all told me what they do, and we were pregnant in 6 weeks. I put a program together. We were pregnant in 6 weeks. And my neighbors heard about that. We lived in married housing on campus, and they had been through artificial insemination and asked if I'd work with them. And I said, well, yeah, I don't think it'll hurt you in any way. Sure, why not? She was pregnant in 3 months. So
Wow,
we came out into practice, just hot to trot, and knowing that there were ways that we could help people. So that is near and dear to my heart, this topic. So Heba, can you tell us a little about your summit and what it is that you're hosting?
Yeah, so thank you firstly so much for having me here on your Facebook Live. It's really a pleasure and an honor as well. So I am hosting a summit which is made for all mums, so young mums, new mums, first-time mums, long-time mums, mums of one, mums of many, and of course mums to be as well, women who are trying to fall pregnant, whether they've had kids or they haven't. And the idea is that, for so many of us, firstly, it can be difficult to fall pregnant, just like in your situation, also in my situation as well. And we can talk a little bit more about that later. But once we are pregnant, and then particularly after we give birth, I've just seen so much in my own personal experience, but also in my professional experience, that women often feel or go through periods where they feel alone or like isolated, or your health kind of plummets, and we see this so much, that so many moms, their health just goes downhill after they have children, whether it's because of sleep and fatigue, or whether it's because of just not having enough time, and so it kind of sets us up for the rest of our lives, and then it's also our children's lives as well. So, because I've worked with like thousands of women here in Australia who have had a lot of issues, particularly around their gut and their pelvic floor. So then I ended up falling pregnant, having my own child as well. And I wanted to do something to kind of give back and educate women, whether whether you're a mum or you want to be a mum, that you can, live a healthier life. And it's just some simple things that you can do to help that. And so, yeah, I interviewed all these experts from all over the world, from Australia and from the US and from the UK and Canada, to kind of, bring together all these minds, these great minds who, have all this wealth of knowledge about, pregnancy nutrition, pregnancy exercise, motherhood nutrition, motherhood exercise, pelvic floor health, gut health, all sorts of, everything to do with, even depression, anxiety, and so on, and just share this information for free in September. So it's on September 10 to 16. So that's in a week and a half. And just, inspire and educate and empower women. So yeah, that's kind of what I'm doing. And I'm really excited to put that out into the world as kind of my gift, being a mom and knowing that those challenges.
You bet. Well, that's really wonderful. And it's really obvious that you've got passion around it. You got juice, which is the most important thing, for a successful event. As we put our hearts into it, then it shines through, and that's obvious with you. Let me give a shout out here. Tracy from South Carolina, hello. Gabriela in Peru, hello, Gabriela. Thank you for joining. My honey's in the audience. She actually had to go downstairs because we only have one internet connection in the room here. So she had to go downstairs and plug in so she can answer questions and put URLs or things in there during the event. But she's on, so that's really nice. Thank you, honey. Trisha Stokes, hi, Trisha. Steph Neckerman, hi. Glad to see you guys. Thank you so much. Kristen Kemery, thank you so much. And so let's dive in a little bit. And one of the reasons why I think this is such an important topic is that people hear me talk about that we don't have time to mess around anymore, that the increased incidence of almost all degenerative diseases, and the extinction of our species is being predicted within 50 years because of all the environmental toxins we have. And you folks have heard me talk about this before to one degree or another. And one of the answers, well, one of the helpful things is that this quote is attributed to Einstein. It says, "The problems that we've created today cannot be solved with the same level of thinking that created the problem." So we have to up our game in how we think about the problems that we're faced with. And that doesn't happen with adults. You know, adults get kind of rigid in the way they think. So it's our children. So it's critically important that we bring healthier children into the world than what we have today. And that sounds like a weird thing to say, but we now know that the autism spectrum, we know now the CDC says it's 1 in 46. And Dr. Stephanie Seneff at MIT tells us that if the increase continues just at the same pace, not increase faster, but just at the same pace, and she's a biostatistician at Yale, no, at MIT, and she said that by 2026, it'll be 1 boy in 2. 1 boy in 2 within the next 8 years will be on the autism spectrum. And you've heard me speak about this and why the toxic chemicals in mom's breasts and in a first pregnancy when she breastfeeds, which is supposed to be the healthiest thing in the world to do, that breast milk can be extremely toxic for a first child. Second child, third child are fine, but because mom's already been detoxed, it came out with the first child. So can you tell us a little about what your thoughts are on, do you talk about detoxing pre-conception, before conception?
Absolutely. And I hear you and completely agree with you. And autism is just one of the things. And, you know, I see this a lot, you know, because you're in the community and, you know, it's just like, oh, this child has autism, this child has autism. You know, you have all these patients that come to you who, you know, have had a long history of autoimmune things or, you know, things that have started from childhood and then their children are also unwell and, you know, intolerant to this and, you know, just, you know, things that you wouldn't think would have happened, you know, 50 years ago, and all these things are just happening now. And, you know, autism just one of the things, right? Like there's so many other things that could be affecting our kids, not just, you know, in their brain, but like their guts and their pelvic floors. Like so many of our kids are constipated. So many of our kids, you know, have pain, chronic pain starting from childhood, you know, emotional, mental health issues. Like it's just everything. There's so many things. And I honestly believe that it does start from the mother. And I mean, even the rate of childhood cancers is up, right? So there's so many things that are happening to our children today that you would never have even imagined could be happening. And I know from personal experience, so I was always a sick child. So ever since I was born, I have always been sick, like recurrent ear infections. Like I don't think I remember a time in my childhood where I didn't have ear infection and then I was on antibiotics. But little did I know that was going to destroy my entire body going on for the rest of my life. And, you know, just so many issues like ear infections, asthma, has like severe asthma, severe eczema, you know, a lot of skin conditions. And at that time I didn't know, but now when I look back, like a lot of mental health issues as well, like a lot of anxiety and depression and fear and, you know, all of these sort of things happening from my childhood. And, you know, it does impact you for the rest of your life. Like you kind of go on and you eat the same foods, you eat the foods that your family cooks for you. You know, I wasn't, you know, I was more of the type of person that liked to, you know, go with exercise, like really hardcore exercise, which you don't realize is actually more stress to your system over time.
Exactly.
And just, you know, so many things. And, you know, and then by the time I was 21, I was like, you know, just fallen apart. Like my body had, you know, I was like, what's, you know, couldn't eat anything. I couldn't eat anything. Like anything I put into my body would make me feel sick. I was very unhappy. I was very stressed out. And I know it's because of, you know, the poor nutrition that my mother had during her pregnancy, then while she was breastfeeding and then the poor nutrition that I had my entire life. And so, you know, you try your best to do the things that you can. Like I tried really hard to, you know, detoxify in my preconception. And it's definitely something that I 100% educate all the women that I work with, you know, because I see a lot of women before they even fall pregnant. Like they come to see me for fertility issues. So I see a lot of women with endometriosis, a lot of women with PCOS, a lot of women who have sexual pain and vaginismus. So I say, before you even think about falling pregnant, we need to get you well. You need to be well, like mind, body, you know, everything needs to be well, and then you can fall pregnant. So yes, preconception detox is super important. And there are actually 2 speakers on the summit who are talking about that, Alex Stewart and Wendy Myers. So talking about preconception detox, because it is really, really important. And then if you don't, which so many women fall pregnant without even realizing it, you know, it can be dangerous to then detox in your pregnancy. So you need to understand how to do it in a safe way while you're pregnant. And then even when you're breastfeeding can be dangerous. As you mentioned, that breast milk can be quite toxic to the firstborn child. And I guess this is why we see so many times the firstborns can be quite ill. And then the secondborn sometimes.
Yes. I'd like to pause there. For some people, this is new information. It sounds pretty weird to them. So I just want to give you guys a little background information. Before I do, just a shout out to Tracy. Whole camp that says, between autism and Alzheimer's, we're in big trouble. Yes. Hello, Tim from Alaska. Catalyst says, yes, that was me. Trauma from the womb to current. And Trisha says, yes, first children are the sponges. I speak from experience with 5 kids. My first child was a testament to not knowing about heavy metal toxicity, result of my toxicity as the eldest child. I'd be happy to privately speak with anyone about this. So thanks, Trisha. And you're on every week, so I know that you've got some background exposures in this area. So thank you for that. So let me just talk a little about this thing about breast milk being toxic, so people understand what we're talking about. I'm going to give you 2 statistics. The first one is that every newborn child today that we check in America, everyone that's checked has on average 180 toxic chemicals in their bloodstream at birth that aren't supposed to be there. They're toxic and toxic to the brain. Many of them are neurotoxins. And it's because mom has these toxins that have been accumulating inside of her. So let's talk about this for a minute with mom and the accumulation inside of her. A study out of Finland. I think it was, I'm sorry, I don't know if it was Finland or Denmark. It was one of the 2. I don't remember which one. It was women, and the question was, in their first pregnancy, should we recommend women not breastfeed in the first pregnancy? And this was a government commission that was supposed to be a 6-month commission, and it went on for 2.5, almost 3 years, because of how volatile the topic was for people. Should we recommend women not breastfeed in a first pregnancy? And where's the logic behind that? Well, these are countries, they eat a lot of fish. And from children all the way up, they're eating fish because fish is healthy for us. And the fish there come from the fjords. The fjords are narrow and deep. Now, the farmers have been using DDT and PCBs for insecticides and pesticides on their crops for decades now. And when it rains, the runoff goes down into the fjords. So the PCBs are in the water. The fish absorb the PCBs, and you eat the fish. Now, there is not one study anywhere that says that eating a fish that's got some PCBs is a problem, because the levels of PCBs in the fish are not that high. They're not supposed to be there, but they're not poisonously high. However, if your detox capabilities don't work very well, the PCBs accumulate in your body, and they're called endocrine disrupting chemicals because they accumulate in the estrogen and testosterone receptor sites and other areas, but in the estrogen loving cells and the testosterone loving cells, these chemicals bind in there. So that's the breasts and the ovaries and the uterus and the testicles. Those are the tissues that hold a lot of these toxic chemicals. So now mom gets pregnant in a first pregnancy, has a healthy pregnancy, has a healthy delivery. Now, and during that last part of the pregnancy and going into the birthing process, the message is coming through really clear: make a lot of milk. It's time to make milk now. So the mammary glands of the breast make milk, and the milk, the raw material, comes from the fat cells of the breast. And the fat cells are where the toxic chemicals are stored. The PCBs are stored. They've been getting stored there for 20, 25 years. So there's 25 years of of accumulation of minor amounts of toxins that aren't so minor anymore. And it comes right through the breast to baby in the breast milk. And the result is baby gets these toxic levels of these PCBs that may affect their brain and nerve development. So the commission came out, the end of their study was, no, it's more important to breastfeed than not breastfeed. And I personally agree with that. You know, it's like you drink water. I mean, water's important. Well, I only have tap water. It's better than no water. Drink water. You know, you need water. You always want the best you can get. So breastfeeding is critically important, more important than not. But our position is every woman of childbearing age needs to be given this information before they get pregnant. So 6 months to a year beforehand, they can go through some soft detox protocols, not aggressive, not really weird, but just simple things you can do that will help over the months prepare you so that you have the best shot to have a baby with the best brain possible. So that's the concept. So with that in mind, please tell us a little more.
I completely hear you. I completely agree. And an interesting point that you brought up was women should be given this education before, right? Like 6 to 12 months before. And this doesn't just apply to detoxification. This applies to everything. This applies to the nutrition, everything that you put into your body, everything that you put on your body, everything that's around your body, right? So, you know, environmental toxins.
Some people don't know. Some women don't know. You put nail polish on your nails, it's in your bloodstream within 4 minutes. And that toxic stuff is in your blood, full of all those chemicals. That's why you need to learn what are healthy cosmetics and much more than that. Please continue.
Absolutely. And that's a big one because, you know, a lot of women wear makeup and nail polish and perfume and, you know, sanitary products, all of our sanitary products as well that we use every month. You know, everything that we're putting on our body is seeping into our body, into our cells and building up and, you know, becoming toxic over time. And we don't realize. And a lot of the time, you know, it's not just nutrition, it's even the way that we exercise and the way that we prepare our bodies for birth. So like, even if you've already had your children, right, like there's still something that you can do now. Like, it doesn't matter. You can still start to safely get better. But what I really loved about what you said was that we should be giving this information, you know, 6 to 12 months before. And this goes for everything. So I work in an area called pelvic floor physical therapy. So we specialize in everything to do with bladder health, bowel health, sexual health, menstrual health, right? And one of the things that one of the most common things that I hear in my clinic is mums coming to me and saying, why didn't anyone tell me this could happen? When they come to me because they're incontinent, they can't control their bladder, or their organs are falling out, or they're having pain with sex after having children. And they're just asking, why didn't anyone tell me, right? And this is something that I'm really active about trying to change, is that we should be educating people, families, women, you know, 6 months before you even fall pregnant. This is what you need to do to prepare your body for pregnancy. And then once you're pregnant, this is what you need to do to prepare your body for birth and then for motherhood, because once the baby comes, everything changes. Like, people think, oh yeah, I'm just going to lose a little bit of sleep here and there, and, you know, but no, it's like you forget to eat, you don't have time to exercise, like all the things that you are doing to help support you and keep you healthy. As soon as you have a baby, it just kind of all goes out the window. So not only is your baby depleting you, but then you're not doing the things that help you, you know, normally before you even had the children. So it's like your negative health, right?
Yeah.
Let's get this information there before. Yeah.
We're getting a lot of comments about the pre-pregnancy and pregnancy time. Tracy says umbilical blood is testing way high for toxins. Pre-pregnancy detox for all my pre-preggers and FDN clients. Way to go, Tracy. So she's got that concept down. Horrible personal care products. So these things accumulate in your body. And then now Jane says, we also have to talk about where our formula comes from, what the cows are fed or exposed to. We run the risk of frightening women from breastfeeding our children. Really good point, Jane. And the purpose of this discussion is to give you the information to make sure that your breast milk is the most potent, loving, nurturing food possible for your baby. Just the cat's meow, you know, just the very best possible. That's the purpose of all this information. It's not to scare you away from breastfeeding. It's really important to breastfeed. There are so many benefits to it. It's really important. And so we want to avoid, especially using cow's milk whenever we can. But our goal here is to give you information so you can prepare for your pregnancy, and then after the delivery, how to take care of the body even more. So please continue.
Even if, you know, you had all these toxins and it was too late, like even if you gave birth and you hadn't detoxified and you did have this, you know, you have this long history of using really heavy makeup, nail polish, hair products, like, you know, eating poorly, like even if you did all that, breastfeeding, the benefits of breastfeeding will still outweigh the risk. And there are things that you can do to safely detoxify even while you're breastfeeding so that it doesn't come out through your breast milk. There are still some things that you can do, right? And we talk about that in Wendy Meyer's interview as well. So, you know, you don't have to feel afraid. Like you know, our world is a bit toxic, right? Like just this world that we're living in, right? But there are things that we can do to make things better, just so that we, even if it's 20% better or 50% better than what it was had we not done it. So, yes, you know, breastfeeding is still super important. Like I'm a mom of a child who is unwell, and I still breastfeed, even though I know that my body probably was like really toxic or something. Like I know that, and I feel, you know, it's you still have to do the best that you can, right? And there's so many benefits that come, even if it's things like, you know, the comfort, the connection, the emotional connection, you know, stress. Like stress is a huge one. Like you know, if you do have an unhealthy baby, just that alleviating that stress through breastfeeding, you know, there's so many benefits to breastfeeding. It's just one thing. Yes. My real focus is how do we get women healthy, no matter what state they are in, preconception, pregnancy, postpartum, menopause even. How do we get them healthy at the point that they are now, regardless of what happened before, right? And there's so many things that we can do, and that's what this summit's about, bringing that education out there. And you know, like pelvic floor stuff is a big one. Like a lot of people don't talk about this. It actually hardly anyone talks about it, and that's one of the big messages that I'm trying to get through. You know, in the next few years, is that we need to start thinking about our pelvic floors. Like, yeah, now we're thinking about our guts. A lot of people are thinking about their gut health. You know, it's slowly starting to come out. But pelvic floor health is definitely influenced by your gut health, and your gut health is influenced by your pelvic floor health. And as a mom, your pelvic floor is one of the most important, if not the most important group of muscles in your body, because, you know, there's so many problems that women have because they're not looking after their pelvic floor. You know, from bladder problems, like not being able to control, like you're actually weeing, you're actually leaking without control. Bowel problems, constipation can be related to gut health. They can also be related to something going wrong in your pelvic floor. Like maybe you have what's called a pelvic organ prolapse, like your organ is slightly sagging down. And the thing is, just because it's happening doesn't mean that, oh, you know, that it's the end of the world. No, these things can actually be fixed. Like pelvic floor physical therapy is 84% successful in the treatment of any pelvic floor disorder. But women don't realize that. They think, oh, I have to live with this for the rest of my life. If you go to see your doctor, or you talk to a family member or a friend, oh yeah, that happened to me after I gave birth. You know, you just have to live with it. No, you don't have to live with it. 84% of women can be cured, all right, if not more. You just have to know what to do. And that's kind of what I want to do, is get that education out there. You don't have to live with it. You don't have to suffer. You can fix yourself. You can heal.
Marvelous. That's just marvelous. And it's very empowering for women to hear that. And you're absolutely right. You just do not have to suffer. A shout out to Zora, who says, fix the mother's gut. That's always of benefit during a pregnancy, and that's safe to do. There's no downside. Interesting you talk about safe detox during pregnancy, that there are some basic things that you can do for that. And it'd be interesting. I'd like to learn a little more about that myself. I'm always extremely cautious about detoxing during pregnancy, but there are some soft shoe things that you can do. And I'm glad that you're including that in your event. Catalyst for Change says, yes, my yoni egg helps with GI dysfunction in my pelvic floor. Yes, there's a number of exercises like that that you can do that help tremendously. Tracy says, the EPA admits to 80,000 known environmental toxins and thousands more that are unclassified. Yes, that's all true. And we're exposed to all of these things. And so we're hearing today about pelvic health, about pregnancy health, about impacts on babies for the environmental toxins that we're all exposed to. And it's such a critical topic. We've got a shout out from Susan Thomas from Dallas, Paula in Alaska. Alaska's in the house. Hi, Paula. Thank you, guys. Good to see you. And so if you have some questions, feel free to type in a questions and we can ask here while we've got an expert on the topic. So feel free to type out any questions you have. In the meantime, tell us a little more about some of the topics on your summit.
Yeah, so we're kind of looking at it in a holistic way. So in the summit, over each day, over 7 days, there will be different topics that we're exploring. So definitely we'll talk about pregnancy health and preconception and detox. And then we'll talk about, babies, bumps and beyond. So for example, we might talk about, in that early postnatal period, for example, breastfeeding definitely coming up, any lactation sort of issues, how to have that healthy baby, how to have healthy kids as they grow as well. But beyond that, the rest of the summit is kind of focused around all mums. So it's not just pregnant women and new mums. It's focused around the longer term mums, the older mums as well. And we explore things like gut health. So gut health, as you know, is super, super important. And how can we optimize that gut health at all stages of motherhood, early motherhood, but also later on as women go through menopause as well, the hormonal changes that occur in our bodies as we age as well, and how we can best, look after ourselves. And then we explore pelvic health, which that's my topic. So as I mentioned, I'm a pelvic floor physical therapist. So we explore things like incontinence, bladder and bowel problems, sexual problems. So we have a whole talk on sexual pain. And, people don't realize it, but it does affect a lot of women. Like in the early postpartum period, up to 85% of women will have pain with intercourse. We talk about birth injuries. So women who have, whether their pelvic floor has torn or they've had perineal tears, or they've had a condition called pelvic organ prolapse, which they may not have heard of, but essentially it's when one or more of your organs kind of sag down in your pelvis, and then it can cause problems down there. And the fact of the matter is that 3 out of 4 mothers will have some type of pelvic floor injury, whether they looked after it or not. And the thing is, beyond that, and the other thing that we talk about is abdominal separation. So some people might know it as diastasis recti, where the abdomen kind of splits during pregnancy and after birth. And the thing that people don't realize is that a lot of the time, if you've got all these pelvic floor problems, it affects your gut health as well. Because if your organs are sagging down, there's now this pull down on your fascia, on your connective tissue, which then pulls down on your abdominal tissue as well. And so women, they might look like, oh, I still look like I'm 5 months pregnant. Or, no matter what I do, no matter what I eat, no matter how I exercise, I can't lose this tummy. But what they haven't looked at is the muscular component or the organ component in their pelvis, right? So trying to put the two pieces together so that you have that optimal, holistic, whole body health. And then we also talk about fitness. So we talk about the right exercises that you should be doing, preconception, in pregnancy, in postpartum, in motherhood, and kind of getting those messages out there that, especially new moms, that you don't have to get back to that pre-baby body. Like your body's changed now. How do I optimize my motherhood body now? How do I get my motherhood body healthy and strong, and so that I can, pick up my kids, or, you're going to be more busy around the house, the more kids that you have as well. How do I keep myself healthy and strong? And I think there's a couple of other topics that have left my mind, but that's kind of the gist of it: nutrition, fitness, pelvic health, gut health.
Well, you're getting continual thumbs up here from everyone, and there's hundreds of them going like this, just constantly, yes, 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 yes. And so that's just marvelous to see. And we'll put the link here for you, for everyone. And I'm not sure if the team has the link right now. It's not posted yet. And if they don't, it will be posted here. So make sure afterwards to come back to the site if it's not here before we're done. And we'll get it posted here as quickly as we can. Usually it would be posted by now, but it's not, and I'm not sure why not, but we will make sure it's there for you.
Thank you.
Okay, so a text message just came in. It's being sent over so that Marzi will be able to post it. So great. Okay, so it'll be posted here in just a minute.
Awesome.
And you know, it's surprising to hear when you say the percentages of women who during or after childbirth have pelvic floor problems. I didn't know that the numbers were that high. And do you have a theory, or you may know why is it this way? How come? So I mean, it's not a mistake of nature that when you have a baby, you're going to lose your pelvic tone. So why is this happening?
So there's a few different things. So let me first give you the statistics. And this isn't to scare anybody. This is so that women know that you're not alone and that it does happen and that you're validated that this isn't something that's normal, but it's something that is common, okay? So just like gut problems today are very common, they are not normal. It is the same thing with pelvic floor problems. They are common, extremely common, but they're not normal. So let me give you a few statistics first. So 3 out of 4 moms who have some type of vaginal birth will have some type of pelvic floor related injury. Now these differ. So you have in pregnancy, okay, it's because of the changes in your body, really. Like when you're pregnant, there is, you know, hormones are surging through your body. Your estrogen climbs, your progesterone climbs, relaxin climbs. That's so that your body can, you know, soften, your ligaments can start to soften so that your pelvis can stretch so that you're able to safely deliver that baby, okay? Now, unfortunately, in pregnancy, about 80% of women will start to experience loss of control of their bladder. So a lot of people will notice that when they cough or sneeze, they might leak, okay? Now, usually after birth, this can improve. However, if you've had a birth injury, so you were pushing during your birth, and this is one of the big things. How are you pushing during birth? Are you on your back, which is a position where your pelvic floor muscles are closed and it doesn't allow for stretch of your pelvic floor? Or are you on all fours or in a squat position where your pelvic floor can open and it can stretch so that you can deliver a baby in a safe way for your pelvic floor, right? So it's firstly, it's the way that we're delivering our babies, okay? The more you're on your back, the more likely you have to have a birth injury, okay? So that's number one. Now, so bladder problems are quite common. Bowel problems. So a lot of women have, unfortunately, perineal tears, where you tear the bit from your vagina to your anus. That little bit in between your vagina and your anus is called your perineum. And in some worst cases, 1 in 8 women actually, sometimes more. So that's 13% of women, about 15% of women will tear not just the perineum from the vagina to the anus, but they will also tear into the anus and into the rectum. That's known as a 3rd or 4th degree perineal tear. And this is where the trouble happens, right? This is where women start to experience fecal incontinence. So, you know, no one's talking about it, but it's happening. 1 in 8 women are not able to control their bowel. And it's not just because of your gut health. It's not just because, you know, you might be eating the wrong thing. Because you've torn some muscles in there, you might not know it, right?
You know, I've heard that it's interesting what you said about the position a woman's in during her pregnancy, or I'm sorry, during the birth process. And it's certainly convenient for the doctor if a woman's on her back on a table and stirrups and all that, but that's not the way our ancestors were designed to do this, you know? So the idea of squatting or being on all fours, and I've heard before about water birthing tanks, you know, in water, that some people have done that and it's really safe for the kid, and it reduces some of the stress involved. That, you know, it's back to the old concept that The way that medicine's been practiced for the last 70 years, 80 years, 90 years is really short-sighted. And this whole, the whole birth process that we go through now with, you may know, I don't know the current numbers, I know they're bad, and you may know, do you know the numbers for C-section? What percentage of women are having C-sections now?
It differs across the world, but here in Australia, it's like 20-30%. Like it's, yeah, it's high, but in the US, it's high as well. So
yes, I've heard in the US it was somewhere around 30 to 35%. That means 1 in 3 women are having C-sections, which is not the way. There's so many, if there's an emergency, you save the mother and the baby's life, no questions asked. But if this is a convenience thing, well, let's schedule you for 8:15 next Tuesday morning for your delivery. I mean, that's just, there's so many problems with that. First off, baby is supposed to come down the birth canal, and there's a number of benefits to that. One of them, of course, you all have heard me talk about before, is that baby gets washed in the soup in the vaginal canal, and that soup is just loaded with bacteria. One of the more common bacteria that's there in the last month of pregnancy is called Prevotella. And you can't find Prevotella in the vaginal tract during the rest of a woman's life, just during the last part of her pregnancy. And it's very high concentration. And why is that? Because Prevotella is carrying the message, okay, baby, because baby comes down the canal, gets covered in this bacteria that gets in the nose and in the mouth and in the eyes and the ears, and it gets down into the gut. And the message is, here's the code for the food that you're about to get, that this mammal is going to be sending you down this food. So let's get the digestive enzymes ready, and let's build a nice microbiome down there to receive this food and digest and break down the food. So when you're born by C-section, and once again, if you need a C-section, if it's an emergency, you get a C-section. You save your life and save the baby's life, and be grateful that you guys are alive. You'll deal with the complications later. But do know that there are complications. And one of them is, baby doesn't come down the birth canal, then the bacteria that colonizes in baby's gut is the bacteria of the birthing room or the operating room. And it's this sterile bacteria that can be nasty stuff. And that's what baby's microbiome, that's what baby's body thinks it's normal, to have strep and to have Klebsiella and to have these nasty bugs there. So the birth process is really important. And this whole concept of the positioning probably makes a big difference in a woman's body's reaction to the birth process and the potential damage that occur. That the positioning is a big deal. It's really a big deal. So I'm glad you're going to be talking about that, and that women can get some really straight answers and guidance on, and start learning some and questions to ask your OB-GYN.
Yeah, like we have a midwife who will be speaking about, or midwife or obstetrician gynecologist as well. We do have a midwife who's talking all about positioning. It's a big thing. It's something that's really important to me, because whenever I'm preparing a woman for birth, so women come to see me in pregnancy because they want to prevent a birth injury. So that's what I do. I help women prevent birth injuries, and then I help them manage birth injuries. So prevention of birth injuries is education about positioning. But the other thing that a lot of people don't do is preparation. And this is a big thing. Birth is not just something that you just go in and do. It's not just something, once upon a time, yes, physiologically women were built, we were more active. We weren't sitting around at desks at work, for example, right? Today, that's what we're doing. So we need to think of birth as like pretty much like a marathon. Like, when you're training for a marathon, you're training for a massive, the Boston Marathon, for example. Here we call it City to Serve. You got to do the heavy work before, and you're at the gym, you're training, you're building your leg muscles, you're building your endurance, you're building your heart capacity. You're training, right? And then the marathon, you're running it, and then just as you cross the finish line, that's birth. Just as birth is just as you cross the finish line. So you can't go on with life just going along, trudging along, doing what you do, and not preparing for your marathon of birth.
Yeah.
So what we do is we train women. Okay, you got to be doing 3 sets of this many squats every day to build up your glutes, to build up your quads, build up your pelvic floor as well, because your pelvic floor, the baseline of your pelvic floor needs to be strong. Because let's say you have a birth injury after birth, if your baseline is high, if you have a strong pelvic floor beforehand, you're going to get back that strong pelvic floor a lot quicker. But if your pelvic floor was so weak, you didn't do anything, and then you gave birth and you damaged your pelvic floor, it's like you're working against yourself, right? Yeah. So it's like, okay, we're going to build you up. And then, okay, you learn about positioning as well. You learn about how am I going to have this safe birth? But then, right, how am I going to actually birth? Like, what is my pelvic floor doing when I give birth? A lot of people do not know, even after they've had children, do not know where their pelvic floor is and how the pelvic floor needs to stretch for you to birth that baby. Like, if you don't know where your pelvic floor is, how are you going to push that baby? Where are you going to be pushing it out from? And the most common thing that women hear in when they're giving birth is, oh, just push out like you're pushing out a number 2. But hang on. Number 2 is your anus. Birthing is your vagina. They're 2 different things, okay? If you're straining your anus, yes, there is some push out in your vagina, but it's not the same. Your brain is sending a message to your anus, not to your vagina. And this is part of the reason why so many women are having perineal tears and anal sphincter tears. So in pregnancy, what we're doing is training you, we're teaching you, hang on, where's your vagina? This is how I let go of my vagina, right? And some people are told, do Kegels, do Kegels, do Kegels, do pelvic floor exercises. But what you should also be doing is what I call reverse Kegels, okay? The opposite. You need to be learning how to let go of your pelvic floor, how to push down through your pelvic floor, because when it comes time to push, you're pushing through the right muscles, and they know you've already learned how to do them. You've practiced, you've trained for that marathon, not just gone in there and waited for somebody to tell me this is, just push like you're pushing out a number 2.
That just makes a lot of sense. And for everyone that's listening, it makes sense that this is a marathon and that you train for a marathon. And the result is you do really well. You cross the finish line and you don't collapse and pass out. It's rather that, boy, that was hard. That was a lot of work, but I'm glad I prepared and it's done. Got two questions for you. The first one comes from Catalyst. She says, after hysterectomy and total colectomy, can pelvic floor work prevent me from having to need a bladder lift? I'm also EDS, hypermobile, and vascular. So how would you answer that?
Yeah. So firstly, shout out to EDS. Me too. Okay. I know what it's like. Chronic muscle joint sublux. I know. I'm there. So I get you. Yes. So prolapse is definitely a higher risk in women who have EDS. Okay. Now, this is what I want you to think about. We have a muscular system and we have a connective tissue system. Okay. In hypermobility and in women, in people, when you have prolapse or when you have a birth injury, it's usually the connective tissue system that's compromised. In EDS, it's the connective tissue system. That is not really under voluntary control. It's the connective tissue system. You can eat well, you can do things, to help you with that collagen and so on. But your muscular system is 100% voluntary control. You can fix your muscular system. So when someone has prolapse, we look at 2 things. We look at how do we support the connective tissue system. And one of the things that I do as a physical therapist is we fit a little device called a pessary. It's a little support device, kind of like, you know how, if you've got breasts, you wear a bra. It's kind of like a bra, but for your bits, okay? So you put this little support device in and it pushes your organs back up. It pushes your organs back up, regardless of whether you've had a hysterectomy. It can push up your bladder or your rectum. And so then now you've got this thing that's pushing up and not causing your connective tissue, your elastic band, to be on strain. Because your bladder, your uterus, if you have one, and your rectum is held up by an elastic band or connective tissue. So when you put this little bra in there, or this support pessary, it pushes it back up. Now, underneath that is your pelvic floor muscles. And these are voluntary control. And if you build up your pelvic floor muscles, you strengthen these guys up, you're now providing another back pressure from underneath to push that up. Now, pelvic floor is really important in people who have hypermobility, but you have to differentiate. And this is where seeing a physical therapist is important. In EDS or in hypermobility, you can have two types of pelvic floor. A pelvic floor that is very, very weak, or a pelvic floor that is very, very tight because it's working really hard to push those organs and those connective tissues back up. So you need to find out firstly, where does your pelvic floor sit? Is it too tight or is it too weak? If it's too tight, I need to let it go. If it's too weak, I need to build it up. And we need to find that happy middle, right? This is why it's so important.
I was going to say that if I had that kind of a problem, I'd want to hear more from you because clearly you know what you're talking about with that. And
yeah, that's why they call me the pelvic expert.
There you go, because you've been there and done that, and that's really interesting to hear. The second question I had for you is, and a different topic, but I saw a video one time of women. A woman during her birthing process that was so relaxed and so had practiced with her partner for so long, she had an orgasm during the birth process. And I believe it was in water. I think it was in the tub, but so is there a protocol that women who are preparing during the pregnancy, and given there are no complications, where it doesn't have to be this tremendously painful, horrible experience that you're trying to last through?
Yeah, so that's interesting. It's actually called orgasmic birth. And it is that your entire body system has gone into this relaxed state. But then because of the contractions and everything that's happening down there, your clitoris is becoming stimulated. And that's what an orgasm is. An orgasm is a stimulation of the clitoral system, okay? And our clitoris is made up of more nerves than are in the male's organs. So the clitoris has so many nerves. And actually, there's a school called orgasmic meditation where you can practice orgasmic meditation even before birth. And then when you're in birth, so let's say you decide to have a water birth, and you don't even have to be a water birth. You can decide to have a birth in your a home birth or a hospital birth, whatever you decide. And you can practice orgasmic meditation, and it's that complete body relaxation. And orgasm is essentially a switch that goes from where in your brain, where you go from, I'm thinking about everything. I'm thinking about the future. I'm thinking about the clothes on the line. I'm thinking about the baby that's going to come. I'm thinking about, all of that stuff, to a switch where you're like, I'm in my body, I'm relaxed, and everything's just happening. The waves, the uterus is, the contractions are happening. The clitoris is becoming stimulated, and it's just these waves and waves, and you're just in the moment in your body, not elsewhere. And that's where that orgasm comes from, right?
Marvelous.
And actually, if you think about it physiologically, I mean, that in itself, the orgasm in itself causes the vagina when you have an orgasm, your vagina is vibrating, right? Like the vagina is vibrating, which can actually be, if you think physiologically, conducive to your birth, because you're using that to push the baby out, right? You're using that. At the same time, you're in a relaxed state, so your pelvic floor is not. And this is the other issue, that women can be so focused on the pain and the trauma and the fear, right, that they clench their pelvic floor. They're tightening it. They're holding on to it. But that's not conducive to birth. Birth is about letting go, right? So that's a lot of the work that we do, is trying to teach women to just let go. Don't be, we're not clenching. We've got to let go. And that actually reduces your risk of birth injury, right? So if that is something that women, if they want to explore, that they can. Another thing that's really great is hypnobirthing. So hypnosis, putting yourself into a state of hypnosis in your body and in your mind, and that can be very conducive to relaxation in your whole body, which, for women, orgasm and all that is a whole body experience. It's about, and relaxation and meditation is a whole body experience. You got to let go everywhere, your mind and your body. So yeah, I hope that makes sense.
It did. It made a lot of sense, and you're getting a lot of hearts Just
Thank you.
popping up here with that one. Well,
Thank you.
this has been really fascinating. And for everyone who's watching, the links are here on your screen. You should be able to see the links, and you can click and register for this event. It'll be coming up in a couple of weeks. And the week after that, my new book launches. So if you haven't had a chance yet, for those of you that haven't heard me talk about it, it's called You Can Fix Your Brain, 1 hour a week to the best memory, productivity, and sleep you've ever had. And so far, we've had about 1,000 people that have pre-ordered the book. And as a result of that, Amazon has ranked us #1 in a number of categories: Alzheimer's and stroke and depression and inflammation, and there are a couple others I'm not remembering. But the more people who pre-order, the more Amazon says, oh my, look at this. And then they make it more visible to the rest of the world. I'm personally very proud of this. I think it's going to be a game changer for a lot of people, giving them an understanding of how to help ensure their brains function for a lifetime, closer to an optimal range. So if you can, folks, those of you that are out there, please consider going to Amazon and pre-ordering the book. And as I've said so many times, and if for any reason you don't like the book, just email me and we'll send you $25. You know, it's fine. You give your money back. It's fine. It's not about the money. I think I get $1.12 or something for every book, but it's really about carrying this message out to the world. And this message that Heba has around pregnancy and post-delivery is a critical message that I've not heard that many people talk about. And I've learned some new things today, and we'll look forward to learning more. So Heba, I want to say thank you so very much for making yourself available. I think it's later there in Australia than it is here in Switzerland. So
it's actually early. It's morning. It's a perfect time.
Oh, it's morning. Oh, good for you. Oh, good for you. And so we're around the globe today, from the U.S. to Peru to Switzerland to Spain to Australia. So thank you very much for being with us. And for everyone that's here, the links are there to register for Heba's event coming up in just under 2 weeks. And look forward to seeing you next week. See you at the same time, same place. Thank you all, everyone. Have a good day.
I just wanted to say one thing. Of course. As a mom, I think your book would be great, because mom brain, firstly, memory, terrible. Sleep, oh my gosh, who sleeps when you're a mom? I think I get like 4 hours of sleep, right?
Yeah.
And all the third thing, memory, sleep, that your book was about. See, I've forgotten already. I'm
energy, productivity, and sleep. Yes, those three.
And productivity, perfect. So I think it's perfect for me as a mom, and I can't wait to buy it as well. And thank you so much, Dr. Tom, for having me on your Facebook Live, and really was a privilege, and it was really fun as well. So thank you.
Thank you, Heba. Fun for me too, and I learned a lot. Thank you so much.